1,000 people a week sell their homes to pay for care, and it's a real worry for people. So there's a number of things we need to do. Firstly, we need to have good home adaptations and telecare at home. And when I was at Northallerton and talking to your colleagues in the North Yorkshire Council, good council actually, doing very good jobs on telecare, you know, and we need more of that across the country to get really good quality telecare at home. Because the ideal thing, of course, is for people to be able to be helped to be independent and at home, and that's about early intervention. It's not just about waiting till people are very dependent and then having lots of people visit them. It's about helping them to be genuinely independent, not requiring lots of people to keep coming in their door all the time. So that's number one. Number two is to make sure that where people have some degree of disability, they have proper support through the benefit system. And therefore we've committed ourselves in the manifesto to maintaining, for example, disability living allowance and attendance allowance, so that if people have a degree of disability, they get, not means tested, but whatever their level of disability, they get help from the state. And then we said, of course, we can't we were discussing about, you know, we don't suddenly have a lot of extra money. So I think we recognise that it is going to have to be a partnership, something, the government doing its bit, but also people who have assets and income make a contribution too. But we think that they will be much better able to make that contribution if they do it through a voluntary insurance programme. So we said, and the central part of this is if people go into long-term residential care, their home is at risk. And I think people will be willing for an upfront premium, which we think will be about £8,000, to buy an insurance, which then means if they go into long-term residential care, all the costs will be met. Not just the care costs, but the hotel costs as well. Now, Labour at the moment are saying nothing really is going to get done about this till 2016. They've pretty much abandoned their proposals. They and the Liberal Democrats are saying, after the election, we plan to have a commission to look at it all. Well, we've been here before. Labour had a commission after 1997, and then they junked it. And I think actually we're in a position where we need to get on, and I think people can see what we're proposing at the election now. I think it's fair in that sense, in that people who don't have assets or income, clearly they get their care free, but people who do have assets and income, at least for an affordable price, should be able to insure against the risk and be able to protect the great majority of their assets so that that's available for them or for their families.
Yeah, will that insurance be available to people who are over 65 now?
Yes, we'll create probably about a period of time, say 2 years, during which people can opt to go in who are already over 65. The only exclusions, unfortunately, would have to be people who are imminently about to go into long-term residential care, because then we'd have the risk of large numbers of people who, because the nature of insurance is you should be insuring against something which is uncertain.
Yes, yes.
If you're trying to insure for something that is certain, of course, insurance is blown away by that, really, because it's adverse
Well,
selection.
old age is pretty certain.
Yes, but only 1 in 5 of the population actually go into long-term residential care. So in terms of an insurance system, 1 in 5 is an insurable risk. And from the public's point of view, it's the sort of risk. I mean, so if there was something that happens 1 in 500 times, people would pretty much say, "I'll take my chances." 1 in 5 is the sort of risk that people would really want to protect themselves against. But equally, as it happens, 1 in 5 is the sort of insurance, is the sort of risk parameters that makes insurance credible in the sense that it reduces the cost. You know, if everybody required long-term care and were paying for it themselves and just paying in advance, it would be like £50,000. And that's a lot of money. Even £8,000 is a lot of money. But actually, if you look at it, at age 65, by and large, people have about £150,000 equity in their house, a couple, plus, on average, if they have any pension beyond, if they have an occupational pension, normally they have a pension lump sum of about £20,000 to £25,000. So it is an option for people, but it's voluntary. You know, and actually, as far as I'm concerned, there is a big difference between that and a compulsory levy, which appears to be what Labour and the Liberal Democrats actually want. Because then, you know, if you were to take responsibility for caring, as you were saying, you know, there are hundreds of thousands of people who care for their relatives inside the family or their husband or wife. A compulsory levy means you take the responsibility yourself and you still end up having your assets taken away from you in order to pay for the system. Well, that's not right.
Mm.
That can't be fair.